Is that okay with everyone? Yeah, okay, I got some nods, fab. So the first thing I wanted to talk about in the doctor-patient relationship is about communication. And this is so important to medicine because it's not just about giving information, it's about how you give information. And it's also about understanding the context of the patients that you're going to be speaking to. Because you want to establish a good relationship with patients. Like medicine, a lot of it is you are speaking to people at very, very vulnerable moments in their lifetime. So you want to be able to build trust in those relationships. And you'll hear a lot about patient-centered care. And one of the ways in which you can kind of explore this is through good, effective communication. And you'll see through medicine, they'll talk about poor communication, which leads to so many complaints. But I want to kind of give you guys a little bit of insight into communication, one of the key ways it is expressed in medicine. I remember when I started medicine, they told us that through medical school, students like their empathy decreases. So hopefully from today, you'll remember to retain your empathy if you do choose to follow with medicine. Now, one of the things that can be a barrier to doctor-patient relationships is jargon, medical jargon. If you've watched any TV shows, Grey's Anatomy, Scrubs, things like that, you've probably heard words that you don't understand, but not just on TV shows. In real life, doctors can sometimes use words that really kind of prove to be barriers to the patients that they're speaking with. So for example, I've got these three words here: crepitus, I have got rhinorrhea, and I've got horripilation. Between us here, does anybody know what these words mean? If you do, that's great. If you don't, just say. No? No? I'm getting a lot of shakes of the head. Okay. What about if I said cracking joints? Would you know what I'm talking about then if I said when you crack your fingers, things like that? You get what I'm saying, yeah? Or what about if I said a runny nose or a cold? Yeah? You know what I'm talking about. Or what about if I said goosebumps? You know what I'm talking about, yeah? That's kind of what it is. You spend, I think, in your first year of medical school, you learn about 4,000 new words, they told us at the start, which is essentially like learning a whole different language. But then by the time you leave medicine, you have to come back to thinking like someone who doesn't know all those words and being able to kind of articulate it depending on the context of the patient you're speaking with.